Welcome to Healthy Care, your trusted source for health and medicine insights. In today's video, we will explore Amitriptyline HCL, its uses, side effects, and important safety information. Let's dive in. Introduction to Amitriptyline. Amitriptyline HCL is a medication commonly prescribed to treat depression. It belongs to a class of drugs known as tricyclic antidepressants, which work by restoring the balance of certain natural substances in the brain. How to use amitriptyline. To use amitriptyline effectively, follow these guidelines. Read the medication guide provided by your pharmacist before starting and with each refill. Take the medication by mouth, as directed by your doctor, usually 1 to 4 times daily. If taking once a day, do so at bedtime to reduce daytime sleepiness. Dosage is based on your medical condition and response to treatment. To reduce side effects like drowsiness, dry mouth, and dizziness, your doctor may start you on a low dose and gradually increase it. Consistency is key. Consistency is crucial for the best results. Take your medication regularly, at the same times each day. Don't increase your dose or use it more often than prescribed, as this won't speed up improvement and may increase side effects. Potential side effects. While taking amitriptyline, you may experience side effects such as drowsiness, dizziness, dry mouth, blurred vision, constipation, weight gain, trouble urinating. If these effects persist or worsen, inform your doctor promptly. Serious side effects and warnings. Seek medical attention if you experience serious side effects like heartburn, bleeding, severe dizziness, or seizures. Rarely, amitriptyline can cause a serious condition called neuroleptic malignant syndrome, NMS. For any allergic reactions, including rash, itching, or trouble breathing, get medical help immediately. Important precautions. Before taking amitriptyline, inform your doctor about your medical history, especially if you have heart problems, liver issues, seizures, mental/mood conditions, glaucoma, diabetes. Avoid alcohol and marijuana, as they can exacerbate side effects like dizziness and drowsiness. Drug interactions. Amitriptyline can interact with other drugs, affecting its efficacy and safety. Provide your doctor with a list of all medications and supplements you're taking. Avoid combining amitriptyline with MAO inhibitors and certain heart medications. Final tips and storage. Store amitriptyline at room temperature, away from light and moisture. Keep it out of reach of children and pets. If you miss a dose, take it as soon as you remember, unless it's near the time of the next dose. Thank you for watching this comprehensive guide on Amitriptyline HCL. For more health and medicine insights, subscribe to Healthy Care and hit the notification bell. Stay healthy and informed. Don't forget to like, share, and comment below if you found this video helpful. See you in the next video.